It causes a condition called oligohydramnios, which presents a high risk for fetal complications or death. There can be several causes of a low amniotic fluid volume, such as leaking membranes, a pregnancy that has gone beyond the due date, various fetal urinary tract abnormalities, and intrauterine growth restriction. We will discuss growth restriction in another lecture. If the membranes are leaking and the leaking has stopped, the membranes may reseal and the amniotic fluid levels could return to normal. Patients with leaking membranes are at increased risk for infection. With oligohydramnios, you will see little or no amniotic fluid on ultrasound. The fetus will appear crowded. Because of the lack of fluid, the fetal parts are more difficult to see clearly. This will be easier to understand after more hands-on scanning. There are two ways to measure oligohydramnios. Use only one of these methods and not both. Before 24 weeks of gestation, measure the maximum vertical pocket. You should also use this method if there are twins. At 24 weeks and later, measure the amniotic fluid index. An MVP less than 3 centimeters or an AFI less than 5 centimeters indicates oligohydramnios. Here are more examples of oligohydramnios. Notice how these fetuses are harder to see here because there is no surrounding fluid. When there is too much amniotic fluid, an opposite condition results called polyhydramnios. Too much amniotic fluid may result in preterm labor or indicate an abnormal fetus. Polyhydramnios can also be caused by diabetes in the mother or a fetal condition like an obstruction of the esophagus or intestines. It is also possible that no cause is found, which is called idiopathic. With polyhydramnios, you will easily see the excess fluid on ultrasound. The fetus will appear to float with a lot of space between the fetus, uterine wall, or placenta. This is a sagittal view of a fetus with polyhydramnios. Notice the large amount of amniotic fluid between the fetus and the anterior wall of the uterus. There are two ways to measure polyhydramnios. Use only one of these methods and not both. Before 24 weeks gestation, measure the maximum vertical pocket. You should also use this method if there are twins. At 24 weeks and later, measure the amniotic fluid index. An MVP greater than 8 centimeters or an AFI greater than 24 centimeters indicates polyhydramnios. This is a transverse view of the fetal abdomen with excess amniotic fluid. Where do you see the excess fluid? Please pause the video now to encourage responses from within the group. This is a transverse view of the abdomen with excess fluid. Here you can see the umbilical cord inserting into the fetal abdomen. Notice again the excess fluid in this image and how the fetus appears to be floating. Let's give an example of how to use the information that you obtain from ultrasound. A patient comes to your health center for a screening ultrasound at 20 weeks. If it is normal, she should return to your health center for a screening ultrasound at 32 to 36 weeks. However, if you diagnose oligohydramnios, she should return for an ultrasound at 26 to 28 weeks. If the oligohydramnios persists, she should be referred to the hospital within days, not weeks. Even if the cause is premature rupture of membranes, oligohydramnios puts the fetus at risk for infection, poor lung development, and even death. Algorithms may vary somewhat according to local practice. You should consult your referral hospital for the algorithms appropriate for your practice. Note that in our algorithm, RH stands for referral hospital. If a patient comes to your health center at 20 weeks and she is diagnosed with polyhydramnios, ask her to come back for another ultrasound in 2 weeks. Often, polyhydramnios will resolve. If the polyhydramnios is worse in 2 weeks, refer the patient to the hospital for evaluation. If a patient comes to your health center after 26 weeks for the first screening ultrasound and it is normal, you should encourage her to deliver at your health center. After 26 weeks, all patients with either oligohydramnios or polyhydramnios should be sent to the referral hospital. Oligohydramnios is an urgent referral. Now let's review the key points from this lecture. What do you think of when you see the words oligohydramnios and polyhydramnios? When should you refer to the hospital immediately? Please pause the video now to give participants time to respond. Oligohydramnios means having low fluid and may be caused by leaking membranes. In oligohydramnios, the amniotic fluid index is less than 5, and this should trigger immediate referral after 26 weeks. Polyhydramnios means having too much fluid. This can be caused by maternal diabetes or fetal conditions. The maximum vertical pocket is 8 centimeters or greater for polyhydramnios, and the patient should also be referred to the hospital after 26 weeks. Now let's review definitions for oligohydramnios and polyhydramnios depending on whether you measured the MVP or AFI. The maximal vertical pocket method should be used in twins and singleton pregnancies less than 24 weeks. Oligohydramnios is diagnosed with an MVP less than 3, and polyhydramnios is diagnosed with an MVP greater than 8. The amniotic fluid index should be used in singleton pregnancies with a gestational age greater than 24 weeks. Oligohydramnios is diagnosed with an AFI less than 5, and polyhydramnios is diagnosed if greater than 24 centimeters. Here are more key points. The amniotic fluid has important functions in protecting the fetus. An abnormal amount of fluid can signal an abnormal pregnancy. Oligo and polyhydramnios can be determined by ultrasound, and proper follow-up is essential for fetal health. If the fluid appears low, perform an AFI. Questions for review. Please pause the video now to discuss these questions and answers among the group. What do the terms oligo and polyhydramnios mean? The answer is that oligohydramnios means decreased fluid and polyhydramnios means increased fluid. What does amniotic fluid do? It cushions the fetus, allows room for the fetus to grow, helps prevent infection, keeps the temperature constant, and helps the fetal lungs to develop. Can you measure a pocket if there is cord or fetal parts in it? The answer is yes, but the measured area of the pocket must be free of cord or fetal parts. What is the normal range for AFI? The answer is 5 to 24 centimeters. What is the normal range for the maximum vertical pocket? The answer is 3 to 8 centimeters. If you diagnose oligohydramnios before 26 weeks, what should you do? The patient should follow up at 26 to 28 weeks. If you diagnose oligohydramnios after 26 weeks, refer to the hospital urgently. If you see polyhydramnios, what should you do? The answer is if polyhydramnios is diagnosed before 26 weeks, follow up in 2 weeks. If polyhydramnios is diagnosed after 26 weeks, refer to the hospital. Finally, what is a near-field artifact? The answer is a fuzzy or hazy cloud seen in the near field that is not real and comes from scattering of the echoes in the body wall. It may look like placenta or the uterine wall. Thank you for your attention and interest in learning pregnancy ultrasound.